gonna do it right. Yeah, I'm taking my time with the highs and lows. I know I'm gonna do it right. Yeah, I'm taking your advice with an empty cup. I know I'm gonna do it right.
Our mandate is really to develop a deep understanding of the local needs on the Gold Coast that devolves decision making down to local communities.
Yeah, I feel alright. Yeah, I feel like I'm heading somewhere. I feel alright. Yeah,
I think we should do community hub.
At the moment, everybody's talking about building a shared vision of the future, and we're doing that by getting people to focus on their experiences when things work well.
For me, I guess it's about the earlier the intervention, the better. The more supports that you can put in place for young people and their families.
I think engaging the community much earlier and trying to show them how they can maximise things rather than just the end negative.
I suppose in our day-to-day jobs we sort of get a chance to think about what would really make a difference in the community, and it was a way to actually put our thoughts down and make them into something tangible. It was really important also to have a forum in which to be able to discuss it, because working in a clinical environment personally, these kinds of ideas aren't always well received.
One of the main aims of the Gold Coast Medicare Local is to work with the community and our service providers to help us all work far more collaboratively in partnership for a much better outcome for our community.
Tamborine and Canungra have been specifically included into the Gold Coast, and so one of our challenges is to make sure that all the work we do welcomes those parts in.
If we think about where we are now and looking ahead, we're going to have to know where we are in order to where we go next.
We know all the evidence tells us particularly 0 to 3 is really, really important, and I can't emphasise enough bulk billing.
But I think we've got to interest our, let's say, our 55-year-old people, because they're still thinking like a teenager on the motorbike, it's never going to happen to me.
What I'm up here today for is to set the scene so our people are still dying too young, up to 17 years less in some cases. That data there should hit home for every single person in this room, both Indigenous and non-Indigenous.
I think information and access is our biggest issue.
What you've got to aim for, I guess, is a variety of ways of getting information out there.
We need to be out there in the parks and pubs and clubs and places that we wouldn't normally go.
One of the reasons we tell stories is because it taps into a different part of the way people think, and people hear more in a story than they would otherwise.
But what I found amazing when I came to the Gold Coast was that the Aboriginal and Torres Strait Islander people were very welcoming, and through Cowan Health Service and the other agencies such as Canungra, I made lots of contacts. So I believe my grandchildren and myself and my family have really benefited from what's happening now with the partnership.
I love Are You OK Day, and I don't think people step out. They may see someone who needs some help, they're not comfortable to ask. I love to reduce those barriers.
To hear a story from someone who's experienced a mental health and drug and alcohol issue within their family and in their lives is something that can't be quantified. It has to be felt by the heart.
The high school she attended knew of her self-harming and thought it better that they didn't contact me and let me know, and they would deal with it in-house. I remember both her and I lying on the bed crying together. She crying because she didn't understand why she was feeling this way, and me crying because I didn't know how to help my daughter. Sorry?
When you're dealing with complex issues, you need to use complex facilitation strategies, because simple strategies will just get the same answers we've always had.
We talked about empowering the networks around consumers and bringing them in when consumers really need it most, because often they're excluded right when parents and carers are very necessary.
And it also helps if you're involved in your community, it breaks down a lot of the intergenerational problems as well.
Mainly my role is sort of helping to connect the children together because they are our future. And if we start building little things like that, to get them involved and to make them feel like, yes, they are important and they're part of the community, to contribute and perform in the community, that would help in big things to come.
I've found today really valuable so far, especially meeting other service providers, which is really good for my role.
I'm meeting lots of nice people, very friendly. My English is funny, but everybody try to listen and understand me, and I feel very comfortable.
Changing our own attitudes about how we connect, which will mean people will connect differently with us.
Talk it, walk it and share it is a great idea because it brings people together and make them as well talk with each other and communicate.
I like to be a more contribute myself, building up healthy, happy community, and I like to be your friend.
So it was great to have some similar-minded people and professionals to share these ideas with.
Just being able to look to the future in 5 years' time and what the ideal would be, I guess.
It's an exciting concept to think about how you can change things in 5 years and what that would look like. And as Liz said, through your work, you come across these things, these needs, these things that you know you need to communicate, and today's just a way to do that, hopefully in a meaningful way that will make a difference.
It's nice to actually have someone listen and give us an opportunity to speak and be heard.
Yeah. Yura Narangwal, Yalwa, Namali Malara. Hey GC, let's talk health and wellbeing.
Hi Gold Coast.
Hey GC.
Hey Gold Coast.
Let's talk health and wellbeing.
Let's talk. Let's talk.
Let's talk health and wellbeing.
Kia ora, talofalava, kia orana, bulavanaka, maloelele. G'day.
Hello Gold Coast. Da li možemo razgovarati o dobrom zdravlju?
Hey Gold Coast, vamos a hablar de salud y de bienestar.
Hey GC, let's talk about
health and well-being.
Hey Gold Coast.
اجازه بدین در مورد سلامتی و بهتر بودن با هم صحبت.
健康と福祉について語り合いましょう。
Hey Gold Coast, let's talk about health and well-being. Hey Gold Coast, let's talk health and well-being.
Hey GC, let's talk
Health and well-being. Hey Gold Coast, let's talk health and well-being.
مرحبا جولد كوست لنتكلم عن الصحة والحياة السعيدة.
我现在手中所拿的这一份呢，就是让我们谈一谈身心计划。
Let's talk health and well-being. Sweet as.
Hey Gold Coast, we must talk long health na lugaw si Mimiet.
Oi, Gold Coast. 健康と体にいいこと話そうよ。
Hey Gold Coast, let's talk about health and wellbeing. Let's talk about it together. Let's talk about all the positive factors, all the negative factors, and feed it all back so we can have a plan that belongs to all of us. Thanks.